And excellent, thank you. That's good to know. Thank you, Bailey. This Zoom meeting is being recorded, so everybody smile big. So, and Kara actually aligned our expert panelists today. So Kara, thank you for your extra work on this amazing event. So this is going to be super. Nicole Langmaid is another one of our team members. She really keeps us rolling as a smooth running chamber machine. Anna Dowd, Director of Membership. And we also have a new team member, Tom Florian. And Tom works closely with Anna in membership as well. So I'm just so excited to be here. Well, I'm gonna give the virtual microphone over to Anna Dowd, and she will introduce our sponsor, Security National Bank. Thank you.
Awesome. Well, thanks so much, Catherine. And thank you to everyone for joining us today. I'm super excited to be able to introduce our presenting sponsor for this series. So big thank you to Security National Bank for supporting this program. They were our sponsor for this program last year, and we are super thrilled to have them on board again for 2021. So thank you to the team at Security National Bank. And with that, I will hand it over to you, Ray.
Thank you, Anna. Thank you, Catherine. And a big thank you to the complete team at the West Des Moines Chamber. You guys are phenomenal, particularly as we migrated through 2020 and all of the impact of COVID. Security National Bank is extremely proud and excited to be associated with this event. We consider the Business Toolkit series subject matters very near and dear, not only to our hearts personally, but also to each one of our businesses as we succeed and attempt to maneuver, if you will, through the past effects of COVID, as well as adjust to what we all may be thinking of as a new norm. I hate using that word norm, but on the other hand, it is what it is. Security National Bank is a $1 billion bank holding company located in Omaha, Nebraska. We have 14 locations, including our newest location, which is the facility that I sit in on Jordan Creek Parkway in West Des Moines. We did open our facility during the COVID impact in March of last year. Some may think that we were a little crazy in attempting to do that. On the other hand, everything was ready to go. We did it. And of course, right after we opened our doors, we had the impact of not only COVID, but PPP loan applications, and we dove headfirst into that. And that was a very successful program, not only round one, but round two for Security National Bank. As I indicated, we're very proud to be a sponsor of this program. I commend the chamber team for continually coming up with new subject matter that is very pertinent to what's going on with all of our businesses. Speaking of businesses, our bank is a community bank, and we focus on what we call our big four. That's our business community, our business customers and their business banking needs, private and personal banking needs of all of the employees, owners, and associates of those business banking customers. We're very strong in trust and wealth management services. And last but not least, just attempting to take care of the complete individual. I'm looking forward to today's program, looking forward to learning more in terms of the impact and how we can deal with these challenges, because we all face them. We see it in our employees, we see it in our customers and clients, and we see the impact on our customers and clients with their employees. So thank you for giving us the opportunity to be here. Thank you to the Chamber for continuing to run this excellent series of programs, and looking forward to today's event. Thank you.
Thank you so much, Ray. And thank you for supporting our small businesses. I know that I say this every time we see you publicly, but again, thank you for supporting our small businesses during this time with all the PPP, the late night hours. You know, you probably weren't getting a sleep for a long time, but, you know, thank you for pulling out all the stops and really helping support our our small businesses now and keeping the doors open, right? So that's what we do here, and that's what our community does. So thank you so much, Ray. Well, I heard a quote the other day that I thought really, really kind of sums up the chamber and what we've done during the pandemic. And the quote is, "Crisis creates an opportunity for action." And that's exactly what we did. That's exactly what the chamber team did. A crisis came and we took action. We doubled down on our programming in every way. And you know what? If it wasn't for the amazing help and expertise of the chamber team, we would not have been able to do that. Every one of our chamber team members is critical to helping support our city, our region during this crazy time we all live in. And one of our very key team members that also helped extraordinarily during this time is Kara Matheson. And I'm so excited to introduce her. Kara is our Director of Workforce. And you probably all know Kara, but I just want to say she's been really critical in helping guide us during this time. We were all brand new a year ago, except Kara. And so Kara continues to be our brain trust. We continue to lean on her deeply, and we want to publicly thank her for all of her amazing help and support. So I'm going to take it away. Thank you, Kara. Exactly. Thank you for the clapping. Exactly. Thank you, Kara. So thank you for being our MC today.
Oh, of course. I'm really excited for this today. And I have to say, we have a very special team that has made this last year possible. It's not just any team that could get through being new and virtual and all the, unknown challenges that we kind of had to navigate this past year. So it's been really rewarding to be a part of. We get to do things like this event today. So we are super excited for everyone to be here. As you may know, it is Mental Health Awareness Month. This isn't just something that is a challenge in people's personal lives. This is absolutely a factor in the professional world as well. And it needs to be talked about. There needs to be additional awareness around this. And I think over the recent years, there has been a lot of progress made with breaking down the stigma of mental health. But people are, they're getting to be a lot more open about it, especially the younger generations that will be entering the workforce soon, which is a positive thing. But businesses then need to know how to navigate these challenges as well. And then, of course, we've had a little thing called COVID over the last year or so that has only increased the mental health crisis that we are in as well. So we know how important it is to equip our businesses with the tools to navigate all kinds of challenges, and the wellness challenge is an absolute priority, and we cannot be more excited to have a panel of experts with us today. So we are going to hear from Liz Cox, the Executive Director of Polk County Health Services, also the CEO of Polk County Mental Health and Disability Services. Mary Thompson, CEO of Clive Behavioral Health Hospital. Dr. Amy Mooney, Clinical Director of Des Moines Therapy and Consulting Services. And Dr. Lena Rydberg, Internal Medicine with the Iowa Clinic. So we are going to get some great information today. They are each going to have about 10 minutes, and then we will open it up to audience Q&A after that. So feel free to utilize the chat to ask questions throughout, and then we will circle back to those at the end. So Liz, would you like to open things up for us?
Sure, happy to. Thanks for inviting me, and thanks for hosting this really important conversation. I'm the Director of Polk County Health Services. We're sort of the mental health arm for the county and provide a lot of resources and information to businesses, agencies, and organizations, but we also ensure that the services are available. And probably now more than ever, we're all looking for those services. I'm just going to go ahead and share my screen. I wanted to there we go. Just share some data with all of everybody, so we just kind of get grounded on what has the impact of COVID been in our communities and within our businesses. So we can all think about what we've experienced since last March. We all had changes at home. We had likely had changes at work, but we also had changes in our community, and some of us had changes in our family. And any one of those changes by themselves can be a very stressful event, but when we pile them all on top of each other, boy, were we in for it, right? So the question is, what's the impact there? What research shows us, and again, we only have research over disasters like tornadoes and floods. We don't have research on pandemics. But when we look at the impact of the mental health consequences of disasters, we've all probably experienced a full array of emotions. I think we're all over Zoom fatigue. We're beyond fatigue and Zoom exhaustion for some of us, but it is a real term. And many of us felt very lonely during our isolation period, or fearful of the changes that were happening, or grief over the loss of traditions. And that has continued over the last year. What we know in the research around the impacts and mental health consequences of disasters is short-term depression, loneliness, anxiety, and sleeplessness. Many of us experienced that probably last year and maybe throughout the summer, but we had to somehow adapt. The longer-term consequences are what we're facing now and in the next 3 years. People are at a greater risk for PTSD-like symptoms, anxiety disorders, and chronic depression, especially if they were middle-aged. I'm raising my hand. I am middle-aged. When that research came forward, I was like, what? Why? When we think about the challenges facing people in their 40s and 50s, many of them have children. They're worried and concerned about the health of their children. Many of them may also have aging adults, and we were very concerned about the health and well-being of our aging parents. And then we also had our own family relationships, so there was a spouse or our own individual health. And so whenever there's a disaster of any kind, it's always sort of those middle-aged folks that feel the biggest pressure. You're also at greater risk for PTSD if you had a worrisome attitude toward any kind of stress. So if you're the type of person that worries a lot, the impact of COVID was more severe for you than, let's say, folks that had a more adaptive response, kind of going with the flow. So folks that showed optimism, were flexible, had really strong social supports, research shows were less likely to develop PTSD, anxiety disorders, or chronic depression. I'm sort of sad that we call it social distancing. I preferred the term physical distancing, socially connected. We all needed our friends when we were in isolation, and we need them now even more when we're coming out of isolation. So what's the data say? Research done in the Household Pulse Survey, which is done by the National Center for Health Statistics, partnered with the Census Bureau and the CDC. It's an online survey, and it just so happened that they happened to do a snapshot the spring, 1 year before the pandemic hit us, to ask folks to self-report symptoms of anxiety or depression. At that time, America was reporting about 10% of our population was reporting symptoms of anxiety or depression. Same time, 1 year later, you can see that number didn't triple, it quadrupled 4 times, almost 38% of America reporting those symptoms. And sometimes I like to say we here in Iowa, oh, that doesn't apply to us. In fact, it does. While our numbers are not as high as the national statistics, they're still quite high. We have a high number of folks reporting symptoms of anxiety and depression, or both. So this is what it looks like. Anxiety is in the green, depression is in the blue, and then the darker blue is that combination of anxiety or depression. You can see it sort of zigzags up and down. If we were going to overlay positivity rates in COVID in our state, it would look very similar. You can see that last year, 4th of July time, we were really happy to get together with each other. And so our anxiety and depression rates went down, but they climbed quite a bit in the fall as our infection rates increased. And then the third phase of the testing, they did 3 phases of testing. Third phase of the testing is showing a decline in anxiety and depression, which is good, obviously. One thing as business leaders, we always want to keep our eye out for is burnout and mental and emotional exhaustion. What are the signs and symptoms there? And what do we do to address it? As business leaders, our workforce is our most valuable asset. So having that mental health literacy and knowing the signs and symptoms on your own team and creating the opportunity for them to have conversations with each other about how they're feeling, critically important as we recover out of COVID. Some bad news is that we have been self-medicating We've been using a lot of alcohol and even drugs to help cope with our anxiety and depression, and it's increased the fatality as a state. So something to look out for if you're a business leader. Might be helpful for you to direct your employees to employee family resources or other resources in the community that can help your employees who might be facing an addiction of some kind. And when we're talking about coping with long-term stress, we all know there are negative ways to cope with it, and then there are positive ways. Maybe some of us have been in that negative side, that unbalanced diet, having little sleep or too much caffeine, that COVID-15. Maybe some of us were self-medicating with food. Or maybe we've gotten angry and lashed out at others, or maybe we've overloaded ourselves with work. Those are not long-term sustainable practices. And so we want to encourage our employees to plan time to decompress, continue eating a healthy diet, spending time outdoors. Like today, I was the one who's like, please, can we play hooky? I want to go outside. It's so beautiful. And making sure we have time for fun. And as our community reopens, I think those opportunities will increase. But those positive relationships we know are the key to not only supporting our mental health, but building resilience within our community. And I think we've got somebody else here to talk about resilience.
Awesome. Thank you so much, Liz, for sharing. That's amazing information to have, especially relevant to the last year and how big of an impact that has had in various different ways and various different levels. But I think everyone has probably seen at least a piece of that in their personal and or professional lives. So thank you so much for sharing. We are going to hand things over to Mary next. Mary, would you like to share?
Yeah, first of all, thanks to all of you for welcoming us to present to all of you. The fact that you're interested in and want to learn more about behavioral health is just really wonderful to hear. So I'm going to talk a little bit about, kind of piggyback on some of what Liz said, and speak a little bit about resiliency and leadership in times of crisis. All of you in the business community have been resilient leaders through this pandemic. I think it's worthwhile pausing just to reflect, what does resiliency really mean? How do we build resiliency for ourselves and for our teams? So self-knowledge and self-care are critical in working through any kind of stressor, and certainly the pandemic was a large stressor. And Kara, I don't know, was anybody able to share my presentation? Since I have Zoom trauma, I cannot share my screen. I don't know why. So I'm very grateful for the help. Like
We've all got it covered. Yeah, just let Bailey know once you'd like to go to the next slide.
Okay, next, let's go to the next slide. So again, we're talking about resiliency. So I think really one thing that's very important is to just pause and acknowledge that this is a very historic event that we've lived through, and just take some time to understand there's been a lot of stress and trauma associated with this event. None of us have lived through a global pandemic. In fact, one of my sayings initially through this crisis was, this is my first global pandemic. And so we had to learn a lot, and we had to learn a lot very quickly, and the stakes were quite high too. So all of that compounds the stress. So one of the things that I think is really, really important is to make sure you develop your own self-care toolkit. So Liz was talking about this in her presentation. What do you like to do that really refreshes you, that brings your mood up and your anxiety down? And I found that for me personally, during the pandemic, some of the things that I had done before were not working as well. I actually took up the hobby of adult color books, which if you would have told me 5 years ago, I would have done that. I would have laughed at you, but I found that to be a very soothing activity during this time. And I think that's what this event has taught us, is that we do have a lot of resilience, and we can be creative in terms of looking for ways to deal with the stress. So as a leader and in a business, what can you add as a toolkit for coping for your team? And businesses have been challenged. Some have moved from being, of course, in person to remote, dealing with people's concerns and anxieties and opinions about how the pandemic should be handled, both in the community and the workplace. So there's been a lot of stressors on teams. And I think, again, as me with my coloring book, what can you do creatively to support your team. And I think that's going to continue to be a challenge as we start to open up again and we stagger back, stagger our contacts and our adjustment and readmission into the community. How do we continue to build that sense of team within our businesses and support employees? So next slide, please. So interestingly, Liz and I both talked about the fact that the COVID feels a lot like a disaster in terms of its impact on really our community supports and our impact as citizens. And typically what we see, in first responders are people close to a natural disaster. And those of you who have been in various settings that have been close to the COVID pandemic, emotional reactions that are typically seen in first responders, you can see them there: depression, suicidality, stress, and substance abuse. And so I think at various times in the pandemic, I would argue that most everyone has had some experience with one or more of these emotional reactions to the pandemic. It's a normal kind of expected response. So when you're in a situation as a business or in a position of leadership, you want to make sure you have some identified ways to communicate with your staff. And one of the ways to do that, of course, is to try and be as clear as possible in your communication to your team. So I think that was a challenge early on when guidance was changing, but I think always more communication is better than less, and trying to be as clear and concise for folks as possible to remove some of the stress of the unknown. Assess your team, always be watching for any conflicts that might bubble up and other issues that might disrupt morale or disrupt your ability to get along and to be productive. One of the ideas I like from the disaster response literature is encouraging a buddy system. So for example, when disaster teams are responding, they're assigned a trusted partner who will keep an eye out for you. So you sometimes may not be aware as an individual that you're having a negative reaction to the stressor. So you may not notice your irritability the way someone else or your buddy would. So the idea is that your buddy or your colleague would be able to tell you, hey, I noticed some changes in you. How are you doing? Do you need to take a little bit of a break? Can I cover for you for a while? So I like that idea of establishing that support or encouraging that kind of support within your team in your business. And then always, I think it's very important to normalize the emotional response to COVID. Make sure that you're, if you have an employee assistance program or some other kind of resource internally through your business structure, that you encourage folks to reach out and receive that support. It's really a sign of resilience to be able to seek out help and to discover new ways of coping as you go through your crisis. And then also, of course, EAP, sometimes folks worry that information about an employee assistance program would come back to the employer. So I think just making sure that people understand that is key to increasing participation. So next slide. So here's some ways to develop resiliency. There's a lot of talk about what does resiliency mean and how do we develop it. So here's some suggestions for you. Show gratitude. That's one thing that I think we've been hearing a lot of just in these introductory remarks, how grateful we are for one another, how grateful we are to be able to get back together out in the community, and just having an opportunity to express and be intentional about that really helps to build people up and to keep people on an even keel. Express thanks. We experiment with that a lot here at Clive. What's the best way to thank your staff? We do handwritten cards. We do sticky notes that we share with staff, with our colleagues. What are some creative ways you can say thank you? There's really no, you cannot say thank you too much. And especially when you have a workforce who's dealing with the stressors that Liz was mentioning, either having multiple generations of family and the stressors of caring for either elderly parents or maybe young children in the house, or those who are single and maybe living alone and are just not having the social interaction that we know keeps us healthy physically and mentally. recognize and call out resiliency. So when you see someone rising to the challenge and being creative and being able to pivot quickly to meet a need of the business or the community, recognize that, call it out, celebrate it. Share healthy coping strategies. We did that some much more probably towards the end of phase 2 and into phase 3, as Liz was describing, in those late fall through to early winter months. What are we doing to take care of ourselves as a team? What did you do last night to kind of regroup? Did you FaceTime some of your extended family you've been missing? Did you get together with friends over a Zoom chat? What did you do? And then also, it's important to remain alert for changes in yourself and others. Sometimes what happens is the old story of the frog in the hot water. The water can heat up and pretty soon it's boiling and you didn't realize the water was that hot. That can certainly happen with mental health. And so I would just encourage you always to know yourself, know your staff, your employees well, and just be on the lookout and attentive to their needs. So next slide, just a little brief update about Clyde Behavioral Health. Clyde Behavioral is a joint venture between Mercy One and Universal Health Services. And we will, at full capacity, operate 134 total inpatient beds. So it's a very large facility. We'll be operating on 2 campuses, 34 on the Des Moines main campus in the Mercy One building. And then our new facility out here in Clive, our 100-bed facility. And we'll have 6 inpatient units here, and then the 3 units at the downtown campus. And then we'll be expanding to our outpatient programs that's coming in the next few months. So we'll have child adolescent treatment on an outpatient basis, adults substance use outpatient, and then a psychiatry clinic for pediatrics. And we're going to be constantly assessing and reassessing the needs of the community and trying to respond to those needs as we build and develop our current programs. And then the last 2 slides are some resources that I wanted to, I'm sorry, I skipped over one. Oh yeah, this is really our, some really nice pictures of our facility. The one on the right, or the left rather, is one of our patient rooms. You can see the beautiful colors we have. One of the features I really like is our windows. So they have the architectural features of the design of the window. And then what you can't see as well in the picture, but there's the windows are opaque except for the very top window where natural light comes through. So it's a very soothing, healing environment. And then especially for our children, we're excited to have a gymnasium. Our staff enjoy it too, and our adult patients, of course, love it as well. So initially, we're in our early phases and we're treating a smaller number of patients than we will over time. But by late summer, and just around the corner, we'll be ramping up our census at both locations. And so you can call us at that 800 number to inquire about our services or ask for an assessment. And next slide. That's it. I appreciate it. I've listed there our key leadership staff and our contact information. Just reach out anytime. We're here and happy to help.
Thank you so much, Mary. There was a lot of good information there. I love the self-care toolkit idea. You know, Catherine's got her jelly beans.
Right.
You mentioned the adult coloring books. I've actually seen those everywhere. So they must be a hit. But then I also appreciated the business angle. You know, you talked about over communication, especially during change, which can be very, very, people can be anxiety prone during that, looking for gaps in morale. And one of my favorite things that you mentioned was the buddy system. I haven't heard of that before. And I think that that is such a good idea because you would be more likely to catch if something is off and someone you are intentionally actively looking out for. And it takes a little bit of that pressure off of a supervisor from having to do that over an entire department or team. So that can make it a little bit more manageable. And it's someone who is probably naturally in their support system anyway. So I think that is a really, really great takeaway for all of our business leaders here on the call today. So thanks,
Kara.
Yeah. All right, let's hand things over to Dr. Lena next.
Hi, I'm Dr. Reitberg. I'm from a primary care physician from Iowa Clinic. I work in internal medicine. And I would say, as we're talking about mental health, we often think about mental health, the entry point for that being one of our great psychiatric partners within the community, being a place where someone would enter via a counselor or enter uh, via a psychiatrist. But a lot of your employees are first coming to their primary care physician when they're encountering mental health. This has been COVID as a natural disaster has been something that all of us have experienced. And really, our mental health providers and facilities have been at the point where they have not been able to accept any more patients. I have certainly seen, as I am looking at my day-to-day schedule, sometimes half of my patients on it will report a positive PHQ-2. So PHQ-2 is a mental health screening assessment that we often do at every appointment, and we're assessing for that baseline level of depression. Maybe somebody wasn't coming in for that particular problem, but they're still screening positive for that. And so when Liz was talking about that Pulse national data, that's accurate. That is what your employees are experiencing. This is a chronic stress event, and chronic stress over time, if coping mechanisms start to break down, if social networks start to break down as we're trying to tell people to stay apart, then people start experiencing symptoms of depression. And especially since it has been more and more difficult to get into some of those mental health providers because so many people have been experiencing it at the same time. A lot of times what they're doing is they're seeking help from their primary care. So we really have seen that day in, day out over the past year. I really liked some of the stuff that Mary was saying about that mental health toolkit. Developing your self-care toolkit is key to try and figure out how you're going to approach this new and different world. As a primary care physician, and I know many of my partners are doing the same thing, as we're sitting down with patients and we're saying, what are you doing to reduce your stress? What are you doing to decompress? You can't change the world that's out there. What are you doing individually to give yourself that space? And then what are your community resources? We partner a lot at Iowa Clinic with Compass Behavioral Health. We also do quite a few referrals over to Mercy Behavioral. Those are all our great community partners, but it oftentimes starts with just encouraging a person to reach out to their primary care first, to get that foot in the door, the next step further along as they need to move that direction. I think an important point to take a look at when you're thinking about what employees are at risk, we are all at risk for trouble with mental health when we have a stressful event. But particularly we need to think about our employees that have had past issues with substance abuse or past issues with anxiety or depression. Both of these disorders maintain remission. So maintain a period of time where they're able to remain sober or remain without significant symptoms because they have strong social support networks. That's oftentimes is key for people in keeping those disorders in remission. But COVID as experience as a community was something that disrupted a lot of that. My patients who have had 15 and 20 years of sobriety have had their in-person meeting groups disrupted because they were afraid of COVID. Well, how else are they going to reach out for that additional social support? Because that is key in helping them maintain that sobriety. And so going through those things and helping people plan out what they're going to do instead, since they haven't been able to be in person, is key. Now that we have vaccination, now that we have cases that have been going down, telling people, hey, it is okay to reach out to that previous social support network that you had before. How can you reconnect with these people again that you haven't been able to be a part of? That could be a way that people can get back in to those services that they have had before.
That's wonderful. That's all really, really helpful. And I think it's a great point that a lot of people might have these initial conversations with their primary care doctor, and that's where you should start. And I've heard that as well, that it can be hard to get in right now. And so I would say keep trying, because you'll find an opening, because they want to see you as much as you want to see them. So thank you so much.
And your doctor also has some very good services where they might be able to do a rapid referral. So as a part of Iowa Clinic, we have that partnership with Compass Behavioral Health where we can do a rapid referral and say, hey, you know, maybe you can't find somebody who's accepting patients, but I can call Eric Barlow and say, you know, this person really needs to get in. What can we do to help get them to services? And so even if you're getting no one saying that they're accepting patients, going to your primary care, a lot of times that person has some sort of way to get you in the door that you need to get in.
Awesome. That's super helpful. Thank you. All right, let's hand things over to Dr. Amy Mooney next.
Okay, thank you so much for having me here today. And all three speakers brought up just wonderful points. I'm going to hit it from a different angle, and I hope it provides kind of a full circle of what everybody's been talking about. So I'm the owner of West Des Moines Therapy and Consulting, as well as Ames Therapy and Consulting, and also have another office on site. And that actually came about because of the impact of COVID. And that's at Turner Corporation. It's got over 1,800 employees. I'll talk about that in a minute. But in regards to our offices, and I think all of them have hit it with showing the rates of anxiety and depression, as well as trying to get into a clinician, the demand for mental health providers has just doubled. So with our offices, we have a psychiatrist, we have a neuropsychologist, we've got over 10 clinicians. We rotate temporary license as well, and they're just completely booked. And what we're seeing is a lot of anxiety and a lot of depression, and also just isolation. So then getting back out, we're seeing a lot of people that might have some new symptoms that they've never had before, like panic. And panic attacks. So these are just some common things I think it's important to share with you, because these are people that have been staying home just like everyone else has. And I think the most important thing is really knowing when to come in. And you've got that gatekeeper, your PCP or your FP, that you go and see that family doctor, and we get lots of referrals there. But a lot of times people are hesitant to go in and see a mental health provider. I also serve on the board of behavioral science for the state of Iowa, and I also reactivated the branch for the American Counseling Association for Iowa. And in doing that, during COVID, we had, of course, other presidents and board members that took over there. They developed, and it's been a wonderful resources for business, clinical telehealth directory for providers that are accepting clients, which has been very, very accepted and been utilized by a lot of different businesses, and also a lot of just clinics and other physicians, but it allows other people to reach out. So that's one resource I did want to share with you through the ACA of Iowa. I'll go back to Turner Corp and talking about that, just to give you guys an idea of affecting businesses. And I think it was wonderful this business recognized what was going on site and noticed that there was an increase in work injury. So our offices specialize in workers' compensation and mental health injury. So we get a lot of referrals from the company. So one of the things that they wanted to brainstorm as we were dealing with the impact of COVID is, how are we going to reduce people on sick leave, not coming into work? We're seeing a lot more aggression on site, and we're seeing more work injury, and that can be due to many factors. So this business incorporated putting mental health providers on site, and we're there 2 days a week providing those services. And I think that I don't know if it was the last week or the one before, but I think it's so important to stress too, people are hesitant to use their EAP. They are very, very worried that the people that they work for will find out, and it is completely confidential. And I know because we deal with EAP all the time, and we guard the patient's information and under HIPAA laws. So, but they are not aware of it. So even as a business owner, very, very important to stress that it's completely confidential and encourage them to utilize it. That's that first step in kind of pushing them to reach out and to a provider for those that are hesitant. I guess the last thing I want to touch on, and it's a little bit outside the scope, but I'm also the director for Grandview University for the clinical mental health program and an associate professor here. And I'll tell you, it's had a large impact even on students within the programs. And we've been extremely proactive. And I'm not going to go through all the components because I think all three of the speakers have already done such a wonderful job hitting on all the ways to be proactive. But it has had an impact on the counselors that we're training and we're trying to bring out into the community. So I think I've kind of hit everything full circle. If there's any questions.
Absolutely. Well, thank you for sharing, and let's open it up to questions. This can apply to, we can hear from any of the different panelists. And I have one to start us off with. Do you have any thoughts on how men versus women navigate mental health? I know we noticed that even on the call today, it is a majority of women. So any thoughts on why that is and how that differs and how they handle things?
I can speak from a data perspective. So what we know from that survey that I shared earlier, you can drill down subpopulation data. Men are reporting fewer symptoms of anxiety and depression versus women, almost 10% less. And men are also receiving less counseling or therapy than women. About 22% fewer men are receiving counseling or therapy. I think some of it, and Amy just touched on it, that stigma component. If there's anything that we can do as a community, is we've just got to stop talking about mental health like it isn't any other type of health condition. If we had cancer or a heart condition, we would talk about it. So the more we talk about it in normal terms, everybody's experienced some sort of mental health episode sometime in their life. I mean, if you've lived a life, you've been sad, or you've had grief, or you've had anxiety over something, or depression, acknowledging that it impacts everybody, and making it okay to ask for help, to reach out for help. And I think part of what we're trying to do as a region is really pull back the curtain on what does help look like. I think we all have a pretty common understanding. If I go to the emergency room with a broken arm, I kind of know what to expect. If I go to the emergency room with a mental health condition, I don't know what to expect, or I only know what I've seen in the movies, like One Flew Over the Cuckoo's Nest. Like I have this really negative impression on how I'm going to be supported. So for us over the next year, we're really going to be kind of talking about what does help look like, what happens when I make that first call, who do I call, when do I call? I like the conversation here about reaching out to your primary healthcare provider first. That's always an option. But if there's a crisis, there's always 911. And we have a really strong mobile crisis unit here in Polk County. So if you call 911 and it's a mental health crisis, help is coming to your doorstep. And that's true for anybody at home or at work or even at school. And we're really lucky to have the support that currently in place from Broadlawns to provide that mobile crisis response. But the stigma is the big part, Kara, and it's a different conversation for men than for women.
Yep. I love what you said about that. And I actually have seen across social media this past year, when it's been talked about much more openly than even in the past handful of years, I've seen images of something that says, it originally says mental health is as important as physical health. And then it's crossed out and it says mental health is health. And it is, and it should be talked about in that way. And we had a similar conversation in our leadership academy a few months ago. And, if someone is going through cancer treatments, let's say, that's talked about really openly for most people who choose to, but it seems to be a little bit different for some people for mental health. So trying to get past that point is something I think that we can all individually work on just in our own circles. So great thoughts there. Thank you. Anyone else want to chime in and add anything?
Yeah, I would agree exactly with what Liz is saying. Men report lower levels of anxiety, depression, but I don't think that actually means they experience lower levels of anxiety and depression. From a primary care perspective, we often see people come in for things that are anxiety and depression, but aren't reported as that. So I will see men coming in for low motivation, low attention span, decreased productivity. Those are apathetic signs, and they are the signs and symptoms of depression in the large majority of people. People did not develop adult onset ADD at the age of 40. They're probably experiencing depression. And so spending time talking to people about what those symptoms are, and that treating it as depression can actually help make them better. And trying to remove some of the stigma from treating it as depression can be groundbreaking for people. If I've talked with some people who have seen particularly their productivity go down in this past year, and they've been surprised as I've talked to them that this is a sign and symptom of depression. Yes, they're a high functioning adult, and so they're still going to work, they're still doing all those things, but they're just 20% less productive than they were before. It's because they need that entry point to recognize and treat the depression, and that is a lot of times been just really life-changing for people as they recognize that.
Absolutely. And I think it helps when people share their experiences of when they have reached out for help. So maybe if businesses foster an environment where people feel comfortable doing so or expressing what their needs may be, then I think that's another way that businesses can play a role in this as well. Thank you. We have another question in the chat. Can someone talk a little bit more about the need for more inpatient services for folks with mental health needs? We understand that there is a shortage, and we'd like to know how are we or should we be addressing that as a community or region?
So this is Mary. I think Liz and I could probably both speak to this question. I kind of smiled when I saw that question because Liz and I kind of live that question every day, as do my co-panelists. We know there's a need for inpatient beds. Our additional 100 beds at Clive is going to have an impact on that, but actually the projections are we need around 400 additional beds across the state. So our impact, while I'm hopeful we'll have a big impact, is still not enough to really meet the pent-up demand. The other worry that I think we all have on this panel is there going to be kind of, we're in that stage where we may see an increased need for behavioral health services. Care has been delayed or deferred for many months now. The pandemic is still impacting us. So I'm expecting that we're going to continue to see an increased demand for services. And because of the delay or the deferred care, we may see increased intensity of symptoms, which would mean more people would require hospitalization. So I think the best thing we can do is look for public-private partnerships, working with our legislators to continue to ask for funding of care. I think one of the things that's been very nice is there's been a lot of understanding of the need for increased care, but we also need dollars behind that to support the care. We need to work on workforce development so that if we do have additional 400 inpatient beds across the state, we have the trained staff to provide that care. So I think those are the main things that I see is, as community activists, you can always advocate for additional services and funding of those services, and continue making that need known. It's made a huge difference for our partnership here and for Clive Behavioral Health.
I can piggyback off of what Mary's talking about. So she's exactly right that, you know, we've all sort of put off, and we also have, we know we've got this tidal wave of need, mental health service for students, for professionals, and for our community at large. One of the things that's unfortunate is that our healthcare community itself has been really traumatized by COVID, and oftentimes they are the last ones to go get the help. So hug a nurse, hug a doctor, they need all the support they can get. But on the other side of the spectrum, what Mary's talking about is crisis services. So if we're in a multi-tiered system of support, or you can kind of think about a health triangle, that at the bottom of the triangle is education and prevention, at the top is crisis, and in the middle is that early identification and early supports. We sometimes, because we're afraid to go get help, or help isn't available to us, we put off getting that help early enough that leads us into crisis. But the other side of that workforce issue is we don't have enough people just providing that direct service. So that early intervention, those counselors and therapists, special education support staff, those people are also really in short supply in our community. So one thing we're doing here in Polk County, and actually we're launching it June 24th, we're creating a workforce task force. We're not going to wait for the state to solve our problems. We have the knowledge, skills, and ability here in our own community to solve our problems around workforce. And they are multidimensional. So somebody talked about the cost for mental health services. Yes, there are different deductibles for getting a physical exam or seeing a doctor versus seeing a specialist, which a mental health counselor would be considered a specialist. And I can tell you, businesses have the opportunity to negotiate with their health insurance providers on the types of services and supports that you want to provide to your employees, including those copays and deductibles. So if you can think about somebody needing mental health services on a weekly basis, if they're seeing a therapist, if the copay is $50 every time, that's $200 a month. That's a lot. If the copay is $25, you're cutting it in half. It is a cost shift more to the employer and increases the expense of the program. But if it gets your employees to get the services that they need earlier to avoid that crisis, then we don't need 400 beds. And our goal as a community is to not need, I'm sorry, Mary, we don't want to need behavioral health, but unfortunately, we're in a situation where we just don't have enough services at that ground level to help people get the services they need sooner, so they are not in crisis.
And that's definitely something for businesses to consider, because although there may be an increase in cost in that situation, you also, if you don't wait and have that early intervention, there's probably going to be a lot of other larger costs later in productivity and morale, and literally in the cost of what you're doing. So that's definitely something to consider, all the leaders on here today. Lena, were you going to add something?
Yeah, I was going to add something. I like what Liz had to say about those tiers of care thing. And one thing that we maybe don't always think about is how to access that middle tier of care. One thing that has been very useful in the Des Moines area is we have strong intensive outpatient programs through both Mercy and Methodist. And that's for somebody who needs more than one-time weekly counseling. And it can be difficult to get into those services, which is part of why I'm so happy that Mercy is adding some, not just inpatient beds, but those intensive outpatients, because those are people that a lot of times can still participate in their day-to-day lives, but they need 2 to 3 to 4 times a week touch base with a stronger support system, so that they're having multiple hour per day additional support. And the wait times for those particular services have also been long. I've had some people who have needed to graduate to that, and their wait time has been 6 weeks to get in. So as we get more and more community access for that, I think that will help us hopefully not need more than the 100 beds that Mercy has just added. I do know when you're looking at those inpatient bed levels, it has helped to open up Mercy, because prior to that, I was sometimes having people go as far as Council Bluffs for their inpatient beds. And that was not an uncommon thing, and it's become less common lately.
Awesome. Thank you. We have another question in the chat that I want to touch on. We've been talking a lot about how this year in particular has been a year like no other and has increased the mental health crisis. And someone made a really good point about how some people are really excited to be turning the page and coming back to work, but other people are less excited because this year has maybe had some additional, I don't even know if the word challenges covers it, you know, maybe they lost friends and family during this pandemic. So their question is if any of the panelists have any advice on how to help an employee who may be suffering from grief and loss and how to make them feel supported as they return to work. Who wants to touch on this one?
This is something that we commonly deal with in primary care. Sorry, oh, Amy, did I interrupt you?
No, go ahead. You're fine.
Okay. Yeah, this is something we commonly deal with in primary care. There is both major depression, but there's also adjustment disorder. And there's also complicated grief. These are things that are not depression in themselves, but they're somebody's approach to their grief and their loss. And understanding the differences. No, maybe a person doesn't have such severe symptoms as would qualify as major depression, and so they want to downplay it. But approaching and recognizing that this is complicated grief and that it's still impacting them can help someone start to understand where they're at and then start to develop some of those additional coping mechanisms that can help them work through and experience their grief. I liked, I think it was Mary that talked about the buddy system. I think that would be a wonderful approach to helping an employee who has gone through grief and loss recently. I know when I'm having patients sit in an exam room, I'm having them talk about what is their buddy, who else can they talk to about this, who understands where they've been, where they're coming from in all the different venues of their life, not just at home, but also at work and also in the social setting, so that they're not existing in these settings without other people that know what they're going through.
Yeah. And something that I think, just to drive it home one more time with the buddy system, because I love that, research shows that 1 in 5 people are going through mental health challenges. So if you take a look at your team, maybe because someone doesn't show it and it's not super obvious, that doesn't mean it's not there. You know, you see those commercials where someone's holding up a sign with a drawn on smiley face on it, and then they move it and then you see what's really going on. So it's important that maybe just because it doesn't seem super obvious, to still be intentional and look out for that. So just a huge thank you to all of the panelists who have shared their expertise and their insights and their advice with all of us. I think it's important to keep this top of mind in our day to day as we are still navigating through this crazy year. So thank you to everyone for being here. And I will send it back really quickly to Catherine to close us out.
Oh my gosh. Well, thank you, everybody. This was so meaningful. I've been taking notes like crazy and thinking how we can apply these to my team. I'm sure everybody else is thinking the same thing, right? How can we, use these for our family, our team, our community? And we just learned so much. So thank you for your time. Really appreciate it. Ray, Security National Bank, thank you again for your generous support and all that you do for our community. Kara, you're an amazing MC. And thank you to the Chamber team for being just amazing. And I'm gonna embarrass you, but I love y'all. So I say that a lot. I do love you, and I love our community deeply. And before I start crying, just love all you guys and have a wonderful afternoon. Enjoy this beautiful sunshine. Thank you.
Thank you.
Thanks,
Thank
everyone.
you, Catherine.
Thank you.
Thank
Thanks
you
so
to
much.
all the team members.
Bye.
And love is a great 4-letter word. Thank you.